Where we're starting is musculoskeletal disease, which is disorders, which is one of the largest healthcare costs out there, and one that frankly doesn't get talked as much about because it often sort of cuts across so many pathologies, and in particular rehabilitation medicine, which is a therapeutic proven to be effective across so many areas. And in particular the physical therapy industry, which is a $30 billion industry that largely sits within that. But today's tools have not changed a whole lot, particularly what goes home with patients or outside of the clinic. There's a lot of cool technology that's been used in the clinic, but we're still using often goniometers or other things to measure essentially plastic protractors to try and measure episodically patients' progress, as well as these home exercise sheets. If any of you have gone through physical therapy, you recognize them. This is probably in the 80th or 90th percentile. Often they're little more than chicken scratch of drawings sort of circled and saying, hey, you should do this 2 sets of 10, 3 times a day. And what we're replacing that with is software built on top of Microsoft's Kinect. For those of you who aren't familiar, it was originally used as a video game platform. They're in about 25 million homes already, and it's a powerful little piece of electronics that retails for a little over $100. It has an infrared sensor, which they use to actually track your motion in three-dimensional space. You are the controller is their tagline from the game world, as well as a video camera and some microphones. So serves actually as a pretty nifty classic telemedicine device as well. And what we have done over the last year is built software on top of that replaces that paper handout. You can see here a model in which the physical therapist or the orthopedic surgeon would still be creating, would still be prescribing what exercise they want you to do, how many reps and sets, as well as how many times a day. You have an educational video that will actually walk you through the proper way, in this case to do a lunge, and then an avatar who coaches you through the right motions, with you being tracked in real time doing the exercises. That allows the patient in real time to get feedback. Are you not lunging low enough? Is your knee going past your toes in a way, is your knee collapsing inwards? All things that can be dangerous during the rehabilitation process, as well as getting a lot of positive feedback about how you're trending. Then what we've done also is build a series of what we're calling gamelets on top of that. This is an example in which maybe you're doing a hamstring curl. Either can use to strengthen your hamstring after a right knee injury or work on your balance after a left knee injury. But instead of just being coached through by an avatar over and over again, you actually create a very similar experience for the clinician. They just say, I want you to do 10 of these, but a very different user experience for the patient, in which they're going through, as they move their leg up and down, the diver's controlled, and goes and gets coins. Obviously also, as you all can see, allows us to create a system of points, gamification, leaderboard type things in order to drive the patient. And we've done a bunch of others like that, a balance exercise as well, for a lot of as well as sort of range of motion game as you're starting. This is often heel slides, classic early exercise done after lots of knee injuries. And then all of this gets uploaded immediately to a cloud server. And you can see here sort of the very skeleton of an application we've put up for some clinical trials we're starting, where we'll roll this into production in design as we commercialize. One thing we realized is when presenting clinicians and patients with the opportunity of what happens if instead of a paper handout, you had a system like this which was capable of tracking patients at 30 frames per second with 20 joint positions and almost an infinite number of calculations you can make off that in terms of range of motion, trend analysis, velocity, and others. How would you use it? What kind of information is most useful to you? We found that they had very poor answers to that question because it was sort of a setup that they had never envisioned having. And so we said, let's build something quickly we can put in a test, and then now have our software designers sitting with the clinicians that are using this in our pilots and actually figuring out what forms of information they like and how to present it. What you can see is actually, here's it's capable of doing a video. Right now it's in a store and forward mode, but in the next few months we'll have a fully enabled sort of telemedicine, so you can imagine a PT or a tech viewing 6, 8 patients that are all doing their exercises, either in their clinic, in a hospital room, or back at home, being able to knock on their doors and give them tips in real time. Information at a dashboard level about how they're adhering to the plan and how it's progressing, as well as detailed information. In this case, you can see this is me doing a set of squats, and you can see my left and right knees. If you see separation of those two, you can tell that they're favoring maybe one side or the other, or if you see sort of a deterioration in that you can tell they're being tired, and also flagging sort of when the rep was counted, or in other times if there was a problem, you could click on it immediately and say what was the feedback that they gave to the patients. Was it in a squat that their knees were collapsing? Was it that they were leaning too far forward or too far backward? Or what is it that I need to work on with them next time they're in the clinic? This information can obviously be shared with the patient at the next clinic visit as a way to interact and connect. And is a great way of actually managing the patients remotely. So the physical therapist or physician, after looking at this, could quickly change the prescription, either to dial back exercises they're having trouble with or push them on to the next phase of rehab because it's clear that they've mastered this set. So we started, a first clinical partner was the United States Navy, and in particular the Navy Medical Center in San Diego. We'll be doing a prehab and probably rehab study as well on total knee replacements, and actually are excited to be working with Dr. Kavidar and his Center for Connected Health about to putting the finishing touches on launching a study on ACL reconstructions, looking also at outcomes, utilization, and adherence. So really excited about laying that foundation. Believe that while we are introducing a lot of things that are fun, and that is obviously a way that we're driving a mechanism for change and action among patients, that this, much like many of the other companies you've seen here, can be considered part of serious clinical medicine.